This educational video is not meant to diagnose, evaluate, prevent, treat, or cure in any manner or by any means or method any person's condition. The diabetic foot with Dr. Joe may alter some pictures to show conditions or events. This show is a checklist of patient behaviors to educate people with diabetes on how to prevent or delay ulcers. The problems of diabetes can grow more critical the more prolonged diabetes is present, especially if not taken care of properly, so check out the checklist and act on it, now. Checklist number 11. Each diabetic foot has a risk category. What is a risk category? The risk category tells how likely a diabetic foot may get an ulcer. Be aware that ulcers can lead to amputations. Is the risk low, medium, or high? Usually, the risk category is based on how much feeling the foot has, if the foot has poor blood flow, if the foot has deformities, and if the foot has already had an ulcer or an amputation. A podiatrist's comprehensive yearly foot examination will tell what category a diabetic foot has. Ask a podiatrist or doctor what category a particular diabetic foot has and how much increased risk that diabetic foot has of forming an ulcer. Checklist number 10. Do the basics. A person with diabetes requires some basic behaviors to protect the feet from ulcers. Here is the checklist of behaviors to prevent hard-to-heal sores we call ulcers. The following basic behaviors are for ulcer prevention. A person with diabetes requires some basic behaviors to protect the feet from sores. Here are some of the behaviors to prevent hard-to-heal sores we call ulcers. Inspect and check the feet every day. Early detection of a problem will prevent more severe problems later. Inspecting is essential for diabetic foot self-care. Wash the feet every day. Washing the feet keeps germs from growing. Washing may prevent athlete's foot, toenail fungus, or skin infections. Washing may prevent sores from becoming infected. Infections can rapidly worsen when people with diabetes cannot fight them off. Moisturize feet but not between the toes. A good time to moisturize is after washing the feet. Moisturizing protects the skin from cracking or tearing. Daily foot care includes moisturizing. Corn and callus care are essential for people with diabetes. A callus can increase pressure by 30% on the foot. Under a callus, a sore can form and hide. Bleeding into a callus is a pre-ulcer and should not be walked on until seen by a doctor. Likewise, corns need care. Trim toenails regularly. Long nails can cause pressure on the toes. Pressure can cause sores. Wear shoes and socks at all times. With numb feet, people with diabetes need professional help with choosing and fitting shoes. Protect diabetic feet from extremes of temperature. Feet can burn quickly. Frostbite can happen unexpectedly. Learn how to keep the blood flowing to the feet. Blood flow is essential to getting good nutrients to the foot and taking waste away from the foot. No smoking. Ask your medical team for help. Smoking is an addiction. Following a diabetic meal plan is essential for people with diabetes. People with diabetes need to stay active. Number 9. Buy and wear proper footwear. Know that you should not wear the shoes that caused an ulcer. Seek professional help in selecting diabetic shoes and orthotics. Have your doctor, podiatrist, or pedorthist approve of all the footwear you wear. If your doctor or podiatrist has recommended diabetic shoes, then wear them when you are on your feet. If you have had an ulcer, you must have proof that your new shoes and orthotics are taking the pressure off. You will need a plantar pressure test for the proof. Talk to your shoe provider about footwear habits such as slippers, water shoes, and proper footwear for your activities. Proper footwear is very important to people with diabetes. The most common cause of self-injury may be ill-fitting shoes. Small changes in a shoe can make big differences in your foot health. Never underestimate the shoe in diabetic foot care. Report foot changes to your medical team immediately. Know that there is no minor injury or disease to the diabetic foot. Have your medical team treat ingrown toenails, athlete's foot, and toenail fungus. People with diabetes may not take their injuries seriously because they cannot feel them. Know that healed ulcers can more easily become sores again. The ulcers can come back when the cause can't be found. If the cause is found, it must be eliminated. So tell your doctor what happened. Look deeply into why it happened. And let your doctor know what you think caused the sore. Tell your doctor what you did about it and how you treated it. Also, discuss with your medical team what changes you need to make so it doesn't happen again. And then change your behaviors so it doesn't happen again. Joshua K. DPM states that whatever the problem is, don't bury it in the shoe and hope it will go away. Number 7. Take your shoes and socks off when seeing your medical providers. Your doctor doesn't have X-ray eyes, so take off your shoes and socks so they can see your feet. Every time you see your medical team, have them check your feet. Also, when your provider is checking your feet, this is a good time for your provider to check your shoes, socks, and orthotics. Number 6. Schedule regular visits to your medical provider. Frequent visits to your medical team reduce amputations. Also, have a comprehensive foot exam at least once a year and more frequently if you are at risk for an ulcer. Make sure your medical provider is a knowledgeable and experienced practitioner that is aware of the latest approaches to diabetic foot care. You must be able to access your medical team at all times, so have a number you can call in the contacts of your cell phone. Number 5. Proper referral. The proper referral is important. You must find a provider experienced in diabetic foot care. If you have an ulcer, a certified wound provider experienced in diabetic foot wounds may save your foot. If you have poor blood flow, seek a vascular doctor familiar with a diabetic foot. If you have an infection that will not heal, seek an infectious disease doctor familiar with diabetic foot infections. You may need many practitioners to care for your foot, such as a foot surgeon, a vascular surgeon, a podiatrist, a diabetes educator, a foot care nurse, a pedorthist, a wound care specialist, and/or a doctor familiar with diabetes, for example, an endocrinologist. You may need a diabetic foot care team. Foot care education helps prevent diabetic ulcers. A person with diabetes may find that a patient's ignorance is not bliss when it comes to diabetes. Know that the eyes do not see what the mind does not know. Controlling your diabetes includes blood sugar monitoring, controlling your blood sugars, a proper meal plan, and regular exercise. Be aware that blood sugar control alone does not prevent neuropathy. A proper meal plan is important. Remember, healthy food is good medicine. Remember, proper exercise is good medicine. High blood pressure needs to be monitored and managed. Cholesterol levels need to be monitored and controlled. Medications may be necessary. The goal of education is prevention, because a pound of prevention in diabetes is worth a ton of cure. Prevention is education in motion. Pressure-relieving orthotics and diabetic shoes prevent ulcers and require proof of their pressure-relieving abilities to prevent sores from returning. The basics of foot care prevent ulcers. Prevention is diet and exercise, and losing extra weight is an important thing to do for prevention. Education is a start, but must be coupled with behavior change. Better health can be achieved by prevention. Problems can be avoided with preventive behaviors. Doing the basics of foot care prevents ulcers. Education in motion is prevention. Prevention is diet and exercise. Losing the weight is an important thing to do for prevention. Prevention may include regular monitoring of foot temperatures with socks, mats, or insoles. Before a sore opens up on the foot in that area increases in temperature because it becomes inflamed. Inflammation is challenging to detect with diabetes because the blood flow may be poor and may not bring the chemicals that make a response to injury to the foot. Prevention may include monitoring foot pressures. Monitoring foot pressures may prevent walking on a foot ready to open up a sore. Remote patient monitoring by insoles of temperature, pressure, and activity levels may prevent an ulcer. Information concerning activities of daily living may expose poor patterns in lifestyle. In this carbon paper pressure image, notice that slow short steps are less pressure than fast long steps. Prevention is not wearing the shoes that caused a sore. A shoe that causes a sore may be tight and pinching the foot. The insole may not be cushioning the foot. Please do not wear the shoes until they have been professionally evaluated. Prevention is not taking one step on an infected foot. If a sore becomes infected, don't even take one step on that foot. The signs of an infection are red, hot, swollen, painful, and/or pus. Remember, the signs of infection may not be noticeable with diabetes. Taking care of yourself involves a willingness to change. That is changing behaviors to healthy behaviors. And allowing other people to take care of you when you can no longer take care of yourself. Problems such as bending problems, arthritis, or low vision will require others to help you. You must be willing to accept the responsibility of your health, such as weight loss, which isn't just about losing weight but keeping it off. Lifestyle education is directed to behavioral change, which is important because change is prevention in motion. Remember, we are friends in the fight for feet. Thanks for watching. If you find this video helpful, please click a thumbs up, subscribe, and leave a comment below.